Today, I'm reacting to 5 of the weirdest ways to die. I wonder how many of these tragedies will take you by surprise, as they surely did to me.
Gender reveal gone wrong. A father-to-be is killed by an explosion while making a gender reveal device.
I mean, like, holy crap. This is absolutely terrifying. We're no stranger to explosive injuries on this channel, just not in this context. My heart goes out to his wife and soon-to-be born child. Despite his wholesome intentions, Chris was working with what amounts to an IED, or improvised explosive device.
28-year-old Chris Peckney was killed in his garage while testing a gender reveal device that should have exploded in a cloud of colored powder.
Though I couldn't find a detailed description of the materials he used, authorities revealed that
his brother was injured by flying shrapnel.
Whatever container he used for his explosive device was reduced to shrapnel upon detonation, with Chris conceivably within arm's reach of the IED. Propelled by sufficient explosive force, many seemingly benign materials can transform into a fatal weapon. The CDC lists these as the most common primary injuries due to bombings, and on this list there are 2 that strike me as the most probable causes of death. Can you guess which? My eyes go straight to abdominal hemorrhage and organ perforation. We already know that the explosion produced shrapnel.
That's the thing that worries us the most, not just the explosion, but the improper containers that it's going to be in will become projectiles.
Unlike the heart and lungs in the upper chest, the abdominal organs are not protected by the rib cage. I can imagine an IED exploding at the height of a workbench, mere inches away from the abdominal cavity, leaving skin, fat, and muscle tissue as the only real lines of protection. If the abdominal aorta was punctured, our patient would enter hemorrhagic shock within only a few minutes. Or if the intestines were punctured, the spillage of partially digested food into the peritoneal cavity could cause peritonitis and subsequent fatal infection.
We have people who get a bit carried away and get so excited about the moment that's ahead that they forget and they want to make it a little over the top.
The fun continues as we turn our attention to the vital organs in the chest. According to the American College of Emergency Physicians, blast lung injury is a major cause of morbidity and mortality for blast victims, both at the scene and among initial survivors. The blast wave's impact upon the lung results in tearing, hemorrhage, contusion, and edema with resultant ventilation-perfusion mismatch, which basically means that the blast damages enough of the tissue where gases are exchanged, that there is not enough tissue remaining that has blood traveling through it that sufficient oxygen can be brought into the body to allow cells to survive. Unfortunately, even a relatively small explosion of, say, 40 psi, roughly equivalent to the pressure involved in a fire extinguisher discharge or a tire blowout, can cause blast lung. The lungs are particularly vulnerable to blast wave injuries as they are filled with air, and this air-soft tissue interface is highly susceptible to pressure changes, while the tissue itself is relatively thin and fragile. And these are only a few of the fatal possibilities involved in mismanaging explosive devices. So if you're planning a gender reveal party, I recommend something safe. Since when did cupcakes go out of fashion?
A shot from a foul ball, Dodger Stadium. The ball hit Linda Goldblum, a mother of 3, grandmother of 7, directly in the head.
This is a terrifying display of chance, and it only gets worse as we learn more about what happened that day.
The trajectory of the ball was hit like a bullet from a gun. Psh.
It's in on it, strike 1.
Obviously, we're dealing with traumatic brain injury, which is often more severe in elderly individuals due to its age-related brain changes, reduced resilience, and slower healing processes. Also, elderly individuals often have comorbid health conditions that can complicate recovery.
Loge, section 106, row C, seat 5. It was her 79th birthday, her 59th wedding anniversary.
Obviously, a TBI, or traumatic brain injury, that doesn't cause loss of consciousness can still be fatal due to factors like intracranial bleeding and secondary brain injuries such as cerebral edema, or swelling. Both bleeding and swelling can cause increased intracranial pressure. Intracranial pressure refers to the pressure inside the skull, whose rigid design cannot expand to accommodate the pressure increase. Thus, when ICP, or intracranial pressure, rises to a critical level, it can lead to reduced blood flow to the brain, compression of vital brain structures, and herniation in the skull. These effects can result in severe neurological deficits and, if left untreated, can be fatal.
The camera never followed the ball into the stands, and the announcers never made any mention of it, even though by now Mrs. Goldblum had been hit.
They asked her, "Are you okay?" She said, "Of course I'm not okay."
You may be surprised to learn that the bones of the skull, specifically the cranial bones, do not significantly weaken with age in the same way that long bones, that is to say, those in the limbs, do due to age-related bone loss or osteoporosis. And none of the aforementioned injuries necessitate a skull fracture, though surely the impact could also have caused one of those as well. Both skull fracture repair and the emergency release of intracranial pressure would have left Mrs. Goldblum in need of surgical attention.
Brody said her mother was then placed in an ambulance. When she vomited, they placed a breathing tube down her throat, and then she went into a coma.
Severe TBIs can directly damage brain structures located in the brainstem that control nausea and vomiting, while elevated intracranial pressure can stimulate the brain's vomiting center, triggering nausea and vomiting as a protective response. On the other hand, while TBIs can increase the risk of stroke through various mechanisms, including blood clot formation, vascular damage, and changes in blood flow regulation, the development of a stroke after TBI is not a direct consequence of the injury and is less common than nausea and vomiting as an immediate response. Unfortunately, Mrs. Goldblum was extremely unlucky that day.
That night, she had brain surgery, but could never recover. 3 days later, she died.
In cases like this, the surgical procedures used typically include craniotomy or burr hole to relieve pressure caused by the injury. Burr holes are small holes that a neurosurgeon makes in the skull, generally less invasive with a shorter recovery period. Craniectomy is typically reserved for more severe cases of intracranial pressure where the brain needs more space to swell and expand. It is unclear which procedure Mrs. Goldblum underwent, but at 79 years of age, both would carry significant risk. My heart goes out to her family. You're probably wondering what a giant papier-mâché dinosaur statue could do to hurt anybody. Well, obviously, you've never dropped your phone inside one. The story goes like this. A man and his son in the Barcelona suburb of Santa Coloma de Gramenet spied something strange inside an old papier-mâché stegosaurus, created to promote a now-closed movie theater. Through a crack in the creature's leg, they saw what looked to be the body of a middle-aged man. They were right. I'm not sure how large the initial hole was to keep the man trapped inside, but authorities have cut a large portion away and replaced it with steel afterwards to prevent a similar tragedy. It looks as though he was trying to retrieve a mobile phone, which he dropped. It looks like he entered the statue head first and couldn't get out. In the articles I read, it was believed that he was trapped inside the statue for at least a couple of days, conceivably without anything to eat or drink. In general, a person can survive for several weeks to several months without food, depending on factors such as body fat reserves, metabolic rate, and overall health. So we can rule out starvation. Without water, on the other hand, a person can typically survive for only a few days to a week, although this can vary. Factors such as temperature, physical activity, and individual differences in metabolism can influence the rate of dehydration. Given the Stegosaurus statue's fairly central location, I'm guessing that at some point when no one was around, he lost consciousness, rendering him unable to call out for help and leaving his body more susceptible to dehydration. Unfortunately, being upside down would have contributed to both loss of consciousness and the dehydration process. The head down position can increase pressure within the skull, potentially affecting brain function and causing loss of consciousness while simultaneously impeding blood flow to the brain. As gravity causes fluids to shift within the body, the head and upper extremities begin to swell, while the lower extremities may experience reduced blood flow and less fluid accumulation, affecting overall fluid balance. The kidneys may perceive the need to excrete more fluids due to the unusual position and ramp up urine production, while the pressure in the head may impact the hypothalamus, the part of the brain that regulates third space and fluid balance. I sincerely hope that he was unconscious, long before the worst of the dehydration process was upon him. As dehydration worsens, vital organs may fail, leading to multiple organ failure and ultimately death if left untreated. Worst of all, it's a treatable condition that simply involves the administration of fluids through an intravenous line, or IV, which allows for rapid and controlled rehydration, helping to restore the body's fluid balance and prevent further complications. Sounds pretty easy, huh? Giant papier-mâché stegosauruses aren't the only killer reptiles on today's list, though.
Look at this. He's still alive. Oh my gosh.
Right. So if you ever find yourself in the presence of a decapitated snakehead, be careful.
Oh, thanks, Doc.
I found an article in the Daily Mail that tells the story of a chef who died after a spitting cobra he was cooking bit him on the hand, a full 20 minutes after he had cut its freaking head off. Snake expert Yang Hong Chang, who has spent 40 years studying cobras, told Daily Mail, all reptiles can function for up to 1 hour after losing body parts, or even their entire body. That seems like a long time, doesn't it? Well, David Penning, assistant professor of biology at Missouri State University, might be able to help us understand. Because snakes don't need to internally maintain their body temperature, they don't need as much energy, which is burned up using oxygen as warm-blooded endotherms do. Endotherm simply refers to an animal that is dependent on or capable of the internal generation of heat. That is to say, warm-blooded mammals. Penning goes on to say, if a mammal loses its head, it will die almost immediately. But snakes and other ectotherms, which don't need as much oxygen to fuel the brain, can probably live on for minutes or even hours, and severing the head isn't going to cause immediate death in the animal. Everything is starting to make sense. The original Daily Mail article tells us, it was as he went to chuck the cobra's head in the bin that it bit him, injecting Mr. Peng with its flesh-killing neurotoxic venom. Reflexively then, it sounds like the snake was attempting to defend itself and strike back against its attacker.
Ooh.
Unfortunately, in this case, a human being.
Have you ever considered how snake venom kills you?
Today, you'll wonder no more. Once the cobra injects venom through their fangs into the victim's bloodstream, the venom spreads rapidly throughout the body. A blood cell can circulate through the body in 1 minute, with variations in circulation speed depending on the specific area and type of blood vessel, in some stretches at speeds up to 3 feet per second. So for a patient who has a strong response to the venom, there really isn't much time to react. As it spreads, neurotoxic cobra venom targets the neuromuscular junction, which is the connection between nerves and muscles, where it interferes with the normal transmission of nerve signals to muscles. To be more precise, the venom's neurotoxins block the action of acetylcholine, a neurotransmitter that transmits signals from nerve cells to muscle cells, thus impeding muscle contraction. Thus, paralysis begins to overtake the victim, beginning with the muscles of the face, throat, and neck, and possibly progressing to affect other muscles, including those involved in breathing. And so, victims of the Indo-Chinese spitting cobra generally asphyxiate after the neurotoxin paralyzes their respiratory system. This refers to the condition where a person is deprived of oxygen, which typically leads to a loss of consciousness relatively quickly.
What's up, dude? Everything from Africa is very defensive. Oh, right in my mouth.
Prolonged asphyxiation without intervention can lead to irreversible brain damage and, of course, death. Surely today's lesson can't get any weirder, right?
Doctors say a Massachusetts man died from eating too much black licorice.
I stand corrected. I'll let Dr. Neil Butala, the cardiac specialist assigned to this patient, provide the details.
A patient came into our hospital with a cardiac arrest, and then we actually found his potassium level was super low.
So, potassium levels in the body play a crucial role in cardiac function, and abnormal potassium levels can have a significant impact on the heart, potentially leading to cardiac arrest. However, low potassium or hypokalemia, is a relatively uncommon direct cause of cardiac arrest compared to other factors such as coronary artery disease, ventricular arrhythmias, structural heart abnormalities, electrolyte imbalances, drug overdoses, sudden cardiac death syndromes, respiratory failure, and trauma. So again, low potassium is
Pretty rare for someone with a cardiac arrest, to be this low in potassium. We thought about the different causes for that.
And when faced with an abnormal situation such as this, we often become a bit like a medical detective.
A classic thing you learn about in medical school is licorice. Licorice toxicity can lead to incredibly low potassium levels.
Black licorice contains a compound called glycyrrhizin that can lead to increased excretion of potassium by the kidneys, which can result in a decrease in the body's potassium levels. More specifically, glycyrrhizin affects a hormone called aldosterone, which regulates electrolyte imbalance in an interaction that causes you to retain salt and water, thus interfering with normal kidney functions involved in potassium regulation. Obviously, this effect can be especially pronounced when individuals consume significant quantities of black licorice over an extended period of time.
We're surprised we actually learned that he ate a fair amount of black licorice. A bag and a half of large candy black licorice, every day for a few weeks.
Black licorice consumption to less than 1 bag a day for the conceivable future. Sounds doable. Again, my condolences to the patients whose stories we've discussed in today's lesson. If you know of any weird ways to die, let me know in the comments down below. And maybe I'll cover one of your suggestions next time I do a video like this. And don't forget to follow my online gym, Cuba 2.0 Fitness, for free right here on YouTube, where we help you move better and become more healthy. If you liked the video, be sure to give it a big thumbs up and subscribe to the channel. If you didn't, be sure to let me know why in the comment section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, and teach one.